Dr. Paul here. I have got something we have never shown you on YouTube. So, a little baby who just had surgery on the scalp. Let's go look. Hello, how you doing?
Doing very well, thank you.
Awesome,
How are you today?
doing great. It's good to see you. You had your surgery?
Yeah.
You did? Yeah. We gotta take that Vicky out and see those great smiles. We gotta see those great smiles.
That's my smile.
Oh my goodness. For our viewers, share with me the journey. What happened?
Sure. So, I suppose the first step of the journey was birth. Like at his C-section, my husband looked at his head and went, "Is that how it's supposed to look?" And I said, "Oh yes, it's fine, no problem."
Yeah.
Okay, so we let it go, and then we came in for our 3-month visit, and we did our head measurement, and that's when it was suggested that maybe, just maybe, something wasn't quite going the way it should have.
Yeah.
So we went for medical imaging, and we got a CT scan. We went and had a consultation with a neurological surgeon, and she gave us the diagnosis of sagittal synostosis.
Mm-hmm.
So he didn't have his little soft spot, not in the back. And so to be able to have room for his brain to grow into his head, it needed to be altered surgically. So we set up the surgery date, and we went in early in the morning, and he was a real champ. He just napped all up until it was time for his surgery.
Cool.
Yeah.
Cool. So we'll pause for a moment and talk about this diagnosis of craniosynostosis. Basically the skull, and you can go online and look at sutures for baby skulls. You know, there's one here, there's one down the middle, there's an occipital and a sagittal. And if they fuse too soon, so where it's supposed to stay open, in fact, a lot of babies will be born, you'll see a ridge, and that's where the plates are actually overlapping, and because they're not fused, they'll spread apart as the head grows. But if they're stuck, like a bone will heal, if you have a broken bone, it heals and bam, it's solid. If it gets solid too soon, that's what we're talking about, craniosynostosis. And imagine the skull. Babies' brains and skulls grow rapidly the first few months of life, and if it's fused, it can't grow. So what was happening when we saw you first was the skull was looking this way long, right?
Yes.
So really long this way. It wasn't able to grow in all directions. So what we have here is post-op. We're about 11-12 days after the surgery. The scar, you know, if you're a new parent, you're going to go, oh my God, right? It's sort of scary looking, but the nice thing about these is, especially if it's not right here, hair is going to cover this. No one will ever know. And they do a little bit of a curvy cut because they don't want where the sutures were fixed. And when they went in to fix that, did they explain how they did it?
A little bit. I didn't particularly want to hear all the gory details.
Are you willing to hear them now?
Sure. Yeah. Now that we're on the other side,
okay,
absolutely.
Good. So basically they take, I mean, it sounds really gory, but they're going to saw through the suture that fused early. Zzz, right? It's like, what? And they're actually cutting through the bone, and then they put I think it's made of silicone, but I could be wrong. But anyway, there's something that will keep that suture open. And then they want this zigzag so your healing is not right over the suture and you don't have tension all in one place. So this is standard. Let's take a close-up look of the top of the head here. You can just kind of see that's a really nice healing suture for where we're at. And did they put dissolvable stitches? They did. So I don't even have to do anything?
Nope. They'll come out on their own.
Talk about making my life easy. That's amazing. That's amazing. Yeah. So the skull shape you were saying is already changing.
Absolutely. We noticed even as soon as he came out of the OR and we were able to see him again.
Interesting. It was that fast.
Yes.
Wow. Yes. I wouldn't have expected that. But now the brain can put pressures and the skull can change. Kind of makes sense actually. Chiropractors and certain massage people will do something craniosacral work with skulls, and when there's plates, they can actually get some changes fairly quickly. So, yeah, who knew?
Indeed.
Amazing.
What a time to be alive.
So, for parents who are watching, if you have a child with a shape of the head that's bothering you, remember 99% of the time or more, like literally 99 out of 100 babies who have a misshapen head, it's slightly lopsided to one side because they're sleeping on one side and putting pressure on one side, and then the head just sort of gets a little lopsided. That's not craniosynostosis. When it's clearly elongated this way or elongated that way, it's like, but it's on both sides typically. Now it could be one-sided, but see your pediatrician or your doctor if you're worried, and we've seen enough skulls, thousands of them. We can usually tell you, oh no, this is normal, but this is without this, we would have had an even worsening head shape, and that wouldn't have been good. No, that wouldn't have been good. No, we wanted to have a good head shape. You fixed it. It's great. Nobody will ever know. No. Oh my goodness. Thank you so much for sharing this with us. Did you have any other points of wisdom to share with maybe parents who are worried?
No, everything went really smoothly for us. The whole team was really great about making sure we had everything that we needed and he had everything that he needed. I did have to go and buy him a new wardrobe of side snaps instead of pullovers.
Oh yeah, because anything pullovers.
Exactly.
Yep. All right.
So he's got a flashy new wardrobe to go with his adventurous scar.
Good.
Yeah.
Good. So anyway, when you have craniosynostosis developing, you don't want to delay too long because the sutures, a lot of the head growth is happening early and you don't want to miss that. But other than that pointer of, have it looked at if you're worried, the fix is pretty simple, and I understand you had a little post-op pain management issues for that first day, but since then it's been fine.
Exactly.
Completely off of pain meds, sleeping well, eating well, doing fine, and really this is just an educational opportunity for you guys, so I want thumbs up, for mom here and our little baby willing to give us an education on craniosynostosis, and hopefully we're going to get some before pictures too so that you can see the difference for yourselves. Thanks for watching. I'm Dr. Paul.